So gastrointestinal diseases. The digestive system is made up of gastrointestinal tract, GI system. Okay, it starts from your mouth and it ends at the anus. Okay, that entire tract. Okay, it's a one way. It's an entire tract that is called the GI tract or gastrointestinal tract. Liver, pancreas, gallbladder are other organs who help the body digest food. Okay. So digestion is important for breaking down the food into nutrients, which your body can use for energy, growth, and even repair. Okay. Carbohydrates are broken down into glucose, proteins are broken down into amino acids, lipids or fats are broken down into fatty acids. This is what we call as digestion. Okay. Some digestive diseases and conditions are acute. Acute means short term. They will have severe symptoms, but you have to suffer for few days. Okay, few days or few weeks, and lasting only for a very short time. Okay, while others are chronic and long lasting. They may not have severe symptoms, but as time passes, the symptoms build up. Okay, there are two types of gastrointestinal diseases. One is functional and one is structural. In functional, something wrong is happening. The physiology is affected. In structural, anatomy is affected. Anatomy means the structure. Physiology means how your body functions. Okay. So what are functional GI diseases? Functional diseases are those in which the GI tract looks normal when you examine it, but it does not move properly. It looks normal. Okay. Anatomy wise, nothing is affected, but the movement that happens in your GI tract, which propels the food forward, okay, that is affected. There are most common problems affecting the GI tract, including your colon and rectum, like constipation. Okay. In constipation, nothing is actually wrong with the anatomy, with the structure of your intestine, but the movement is impacted. It's very slow. Okay, that is what constipation is. Irritable bowel syndrome, IBS. There is inflammation here and there. Okay, but nothing is wrong. Nothing wrong is happening to the structure. Just inflammation of the intestine has taken place everywhere. Okay, nausea, gas. Okay, when you feel nauseated, you feel like vomiting. Okay, when you have gas, bloating, or when you suffer from diarrhea. Okay, so what happens in these conditions? Structural integrity is healthy. There is nothing structurally wrong with your GI system, but the function is affected. Okay, the way how it has to work, the way how your GI system has to work, that is affected. Okay, is it clear about functional GI disease? Then there are many factors that can upset your GI tract or even its motility. What is motility? The ability to keep moving or keep moving the food. That is motility of your GI. Okay, so when you eat a food that is very low in fiber, okay, your diet lacks fiber. You are not getting enough exercise. Okay, you are traveling. When you travel, when there is jet lag and everything, your GI system also gets altered. Okay, any changes in your routine, immediately you change up your routine. Okay, that can also affect your GI system. Eating large amount of dairy products, that could, on top of that, if you are lactose intolerant and when you eat large amount of dairy products, it can also trigger IBS. Then stress. Stress can also cause inflammation in your stomach, in your GI system. Resisting the urge to have bowel movement early morning or when you, based on your routine, when you feel like you have to empty your bowel, you have to go to number two. Okay, and when you resist the urge of it, when you feel like you want to go to the loo, but you are busy with something and you you try to resist the feel of going to the loo. Okay, that could also lead to hemorrhoids, or that could also change the motility of your intestine. Overusing anti-diarrheal medication. Okay, medications that we use to stop diarrhea, okay, or contain diarrhea, if you are overusing it, that could also alter your GI motility. Taking antacid medicines that contain calcium or aluminum. Okay, antacid is like when you have acidity. When you suffer from acidity, and when you take antacids, that like the pink syrup that you have, okay, Rantac, omeprazole, these all are antacid medications. So if you're taking antacids that have calcium or aluminum, that can also affect the GI motility. Okay, taking certain medicines, especially antidepressants, folic acid pills, folate pills, ferrous sulfate pills, iron pills, strong pain medications like narcotics, like morphine. Okay, morphine is an example of a narcotic pain medicine, analgesic. Okay, these medications can also alter your GI system. Pregnancy. In pregnancy, there is a structural change as well. Okay, the entire intestine and the organs are pushed upwards when the uterus is growing. So definitely some GI issues the mother will, pregnant woman will face. Okay. Then what are structural gastrointestinal diseases? Structure. Here anatomy is affected. Okay. So in structural GI diseases are those where your bowel looks abnormal on when you examine it. Okay, and also on top of it, it is not working properly. When you take an barium swallow, okay, barium swallow is a kind of imaging in what in which in radiology department they give you a barium drink. Barium, okay, it's a metal, so which will not cause much harm to your body. Okay, barium because of barium's opacity towards X-ray, barium is given. Barium swallow is a diagnosis procedure. So when you do the barium swallow study, whatever structurally is wrong with your intestine, that you can see in the X-ray. In X-ray, usually you check it for bones, right? Because bones will not allow the X-ray rays to pass through it. That's the reason why you can visualize bones. The same way, barium will not allow X-ray rays to pass through it. So when you drink this barium solution, okay, it goes through your entire gastrointestinal tract, and wherever it passes through, it leaves some of the pigment. And if there is any structurally something is wrong, some hollow is there, or some ulcer is there, or some tumor is there, okay, it will, the barium will coat that area and it will move forward. And immediately after barium swallow, when you take an X-ray, you will see exactly where you have lumps, bumps, ulcers. Okay, it is seen. So this is one diagnosis that we can use to find out peptic ulcers or some tumors or any blockages that is there in your intestine. Okay. Sometimes any structural abnormality should be removed surgically. Okay. Yeah, weight loss will be there because of GI diseases, because gastrointestinal diseases, they affect your appetite. Okay. So some common structural GI diseases are strictures. In strictures, there is constriction. Okay. Stenosis, narrowing of certain areas of your intestine will narrow off. Hemorrhoids is like piles. Okay, piles. If you know what piles is, we will see the image of it. Piles. Diverticular diseases, it's outpouching which is seen in the intestine. When we will do diet in GI diseases, all of this will be discussed in detail. Okay. Colon polyps. Polyps is an extended, it's kind of a non-cancerous tumorous growth. Okay, that extends into your intestine. Colon cancer, inflammatory bowel disease. So constipation, the functional disease. We start with some functional diseases. It's a functional problem in which it is hard for you to pass your stools, okay, to have a bowel movement, to go to the loo, okay. And stools are infrequent, less than 3 times a week, or it is incomplete, okay. Even after passing the loo, you still feel it is not done properly, okay. And constipation is often related to inadequate roughage or fiber. Fiber is also called roughage, okay. Inadequate roughage or fiber in your diet, that could lead to constipation. And a disruption in your regular routine. You were following a regular routine because of your traveling, because of some festivals, family holiday, okay, or some medical procedures, sick leaves, something. Because of these reasons, your normal routine was disrupted. That could also lead to constipation. Stress can lead to constipation, okay. And constipation will cause you to strain during bowel movement. You have to like push your feces out, okay. A lot of straining is required to get the feces out, okay. This may cause small or hard stools as well. Okay, so when your feces look like this, it is type 1 constipation. Hard lumps like nuts, it is very difficult to pass. Type 2, sausage shaped, but it is still lumpy. Type 3, again, cracked surfaces. And these are easier to pass. And after type 3 and type 4, we can still be normal. Type 3, 5 onwards, it is like diarrhea, okay. You can treat constipation at home by, you have to increase fiber in your diet and increase water in your diet, exercise regularly, increasing the intensity of the exercise, like doing more resistance training. Okay, constipation can be treated. Moving your bowels when you have the urge. As soon as you have the urge to pass feces, to empty your bowel, immediately find a loo and move your bowels. Okay, don't resist the urge. If this treatment does not work, only then you have to take laxative. Okay, laxatives, there are natural laxatives and there are medicinal laxatives as well. Okay, it can be useful as per the advice of your doctor. Then IBS, irritable bowel syndrome. What happens here is, here and there in various parts of the bowel, inflammation will be there and there will be abnormal contractions. Okay, when the food is passing through the large intestine, one part should contract, then the food is pushed forward. Okay, one part contracts and one part relaxes. Okay, the relaxing part will receive the food, the contracting part will push the food. This is called the peristalsis movement. Okay, but in IBS, contractions are abnormal. It can happen anywhere, irrespective of the passage of food. Okay, contractions should begin at the ileum part and it should move towards the anal part. Okay, anus part. So it should have a clockwise direction. Okay, contraction should happen clockwise. In clockwise flow, the contraction should happen. But when a person is suffering from IBS, contractions can take place anywhere. To get at the same time, two places in your intestine can also have contractions. Okay, so those are abnormal contractions that takes place in irritable bowel syndrome, IBS. Okay, am I audible to all? It's also called as spastic colon. Spasm means again abnormal contractions here and there. Okay, irritable colon, spastic colon, nervous stomach. These are the other names for irritable bowel syndrome. Again, it's a functional condition where your intestinal muscles contract more or less often than normal, either too much contraction or too less contraction than what is normal. Okay. Certain foods and medicine and even emotional stress can trigger your IBS. Okay. Abdominal pain, cramps, excess gas, bloating, bowel habits like constipation. It could be too hard feces, too loose feces. Okay, more urgent stools than normal. The person may suffer from constipation or diarrhea. If the contractions is less than normal, then the person will suffer from constipation. If the contractions are more than normal, the person will suffer from diarrhea. Okay. So irritable bowel syndrome, you can either have constipation or diarrhea based on your contractions. Okay. You can treat IBS also at home by avoiding excessive caffeine, avoid coffee, green tea or very light version of tea. You can have that. Avoid lactose-based diet, increasing fiber in your diet. Keep a check of the food that triggers your IBS. Sometimes you may be intolerant to certain food. Okay, immediately after having some specific spices or some flavored food, okay, your IBS can be triggered. So avoid those food. Then minimize stress or learning different ways to cope with stress. Take medicines, whatever the doctor prescribes. Avoid dehydration, okay, throughout the day. Be well hydrated and get good rest and sleep. Next you have is hemorrhoids. Hemorrhoids like piles, okay. What are hemorrhoids? These are dilated veins in your anal canal from where the feces falls off. That is your anal canal, okay. So here the veins are dilated. You can see here this blue part, that's the vein. Veins take the deoxygenated blood back into the circulation, okay. So veins are present in your anal canal as well. So these veins become dilated, and veins are more prone to dilation than arteries because they have to work against gravity. Okay, veins have to work against gravity. Arteries have a much stronger contraction as compared to veins. Veins have to work against gravity. So pooling of blood takes place more often in veins as compared to arteries. Okay. So they are caused by chronic access pressure. When you sit on the this commode for longer duration, it is very common nowadays. You take your smartphone or you read in a newspaper in the sitting on the commode early morning. Okay, you take up more than usual time. Okay, when you are sitting in that position for more than usual time, okay, there is a strain caused on your rectum, and that causes hemorrhoids. Okay, persistent diarrhea. Yeah, frequently having diarrhea, because when you have diarrhea, the frequency of running to the loo is increased. The more so you are spending more time in the loo in different intervals of time. Okay, so that can also cause hemorrhoids because you are sitting in that position for longer duration at various intervals. During pregnancy also, the frequency of going to the loo increases. So in pregnancy also, risk for hemorrhoids is there. So there are two types of hemorrhoids, internal and external. So internal hemorrhoids, which is not that visible from outside, okay? These are blood vessels which are inside of your anal opening. When they fall down into the anus because of the straining and because of the weight of the blood that has pooled in the veins, okay? Because of that, it slowly falls down. Okay, the veins slowly, because of gravity, they slowly not completely fall down, but their position shifts. Their position shifts more downwards because of the gravity of and the weight of the blood that has pooled in the vein. Okay. So when they gradually fall down into the anus, and when you are passing the stool as well, hard constipated stool when you're passing, they can become irritated because of the pressure of the stool that is passing, and the pressure of the stool, hard stool, that it puts on these dilated veins. It can start to bleed. Okay. Ultimately, internal hemorrhoids can fall down enough to prolapse, or it can stick out of the anus as well. Okay, if it is not treated on time. This is internal hemorrhoids. Am I audible to all? Then treatment includes, you have to improve your bowel habits by avoiding constipation. How do you avoid constipation? Drink more water, have more fiber in your diet. Okay. Don't strain during the bowel movements, because you know you have hemorrhoids, dilated veins there. If you strain, the pressure can also burst your veins open. Okay. The passing of the hard feces can also burst the veins open. So don't strain while passing the bowel movements. Okay. Your healthcare provider can also use ligating bands to eliminate the vessels that have dilated. Okay. Or they can be removed surgically as well. If it is too serious, only then surgical removement is uh, prescribed. And surgery is needed only for very small number of people who have very large and painful and persistent hemorrhoids. Okay. Then you have external hemorrhoids. Again, these are veins that lie just under the skin outside the anus, but not in the anal canal. You can see here, this is the anal canal. Okay. This pink area, dark pink area, is the anal canal. But external hemorrhoids are not here. They are just under the skin of the anus. Okay, not in the anal canal. Okay, just outside. So this area is also having veins, and because sitting for a long period of time on the commode, blood can get pooled here as well, leading to hemorrhoids. Sometimes after straining, the external hemorrhoids can burst, okay, and it can form blood clots under the skin. Even though the hemorrhoids are bursting, it will not bleed out, okay, it will just cause blood clots under the skin, which is visible, okay, and this is what we call as piles. It's a painful condition. You treatment, you can just surgically remove the clot, okay, under local anesthesia, and you can remove the hemorrhoid as well under local anesthesia. It's not an extensive surgery. So about hemorrhoids, is it clear? Hemorrhoids or piles. Next is anal fissures. These are also structural disease, not functional, but structural, because the structure of the anal canal is damaged here. So you can see here the splits or cracks in the lining of your anus. Okay, from here the feces passes outside, and some cracks or splits are there in this anal canal. And because of this split or crack, it exposes the underlying tissues to the passage of stool. So what happens if the stool is passing through it, the feces is passing through this area, the particles of the feces can get stuck here, and that could cause inflammation, infection. Okay, it can cause burning pain, spasm. Okay, after whatever bowel movement you're done, but some part of the feces is still stuck inside in the splits or cracks. It will cause infection as well. Okay. And common cause of this anal fissure is that when the stools are too hard, okay, you're having severe constipation, and these hard stools can cause bruises on your anal canal. That's how fissures can happen. Or sometimes you are undergoing a prolonged diarrheal episode, and too many watery stools you are passing. Too much of moisture and too much of water can also make that skin in the anal canal so soft that it can cut open. Okay. So in both the cases, too hard stools and too watery stools, both can cause anal fissures. Okay. Initial treatment, you will be given pain medicine, more dietary fiber in your diet, so that we can prevent large bulky stools. Sitz bath, in sitz bath, the abdominal and pelvic area is put in a sink. You will be sitting in a bathtub. You will sit, and it's a warm water with some medication. Okay, is given. Okay, a tub which you use at the home, in that also, in which you can sit. Okay, warm water is used. Some medications can be put. Pain relieving medication can be put in that water, and the person can sit there for 10 to 15 minutes. It sits bath. Okay, the warmth of the water will reduce the pain. And if this treatment is not reducing the pain, surgery would be required. Then perianal abscesses, again, structural disease in which abscess formation means pus formation. Okay. When tiny anal glands that open inside your anus, if they become blocked, okay, if there is any blockages, because these tiny glands provides moisture, it gives mucus into the anal canal. Okay, it keeps the area well moisturized. Okay, so if these glands get blocked, okay, the fluid secreted by them will also be blocked. Bacteria will be present, and it will lead to infection. Okay, and when infection is there, that's when pus formation is there. Okay, that is abscess. So when pus develops, abscess formation is there, which is painful. Okay, you will have to visit your doctor, and they will use a syringe to drain, empty the abscess, take away the entire pus. Usually under local anesthesia, it is done. Local anesthesia will be put on the area where abscess is there, and using a syringe, the abscess will be, or the pus will be drained out. Okay. Anal fistula. What is fistula? An abnormal opening. Abnormal opening, which is not supposed to be there. Okay. So the feces should go inside, should go from top to down, and an internal opening happened because of frequent cracks and splits. Okay, and anal fissures, frequently that is happening because of that, over a long period of time, and it was not treated properly. Okay, and if surgery was not done properly, stitches were not done properly, that could lead to an anal fistula, abnormal opening. So this area should be, this is a normal area. Okay, the other part, the right side, should also look like that, like the left part, but an abnormal internal opening happened because of anal fissures or anal abscess or untreated fissures or untreated abscess. And anal abscess is also formed here, and an anal fistular tract is formed. Okay, this is an improper abnormal opening that happened. Okay, so this is anal fistula. Again, it's a structural disease. You have to drain, if there is any abscess, it has to be drained out by the physician. It's an abnormal tube-like passageway from the anal canal to the hole in the skin. Okay, and the body waste can also travel through this anal canal. And if it cannot travel out, it will be stuck there, and it will cause infection. Okay, it will cause itching, irritation, pain, bleeding. Okay, so it has to be drained. They don't these fistulas will not heal by themselves. Surgery is required to close them up, to close off the fistula. Then you have diverticular disease. So diverticulosis is the presence of small outpouchings. You can see here small outpouchings, a pouch-like structure on the outside. Okay, small outpouchings have taken place in the muscular layer of your intestine. Okay, and it's because this happens in a weak intestine. Okay, in a weak large intestine, these small outpouchings can happen. What is the drawback in this? When the waste matter is passing through the intestine, this waste matter can get stuck in this outpouching. You can see here. Okay, waste matter is getting stuck in this outpouching. It will stay there and cause inflammation. This outpouching which you see is what we call as diverticuli. Okay, it is called diverticuli. So when a fecal matter is stuck here, okay, a fecal matter, when it is stuck here, it will stay there and cause inflammation. So we call it as diverticulitis. Okay. So the treatment of diverticulitis, first you have to treat constipation. Some antibiotics will be required because if it stays here and causes infection, bacterial infection, antibiotics will be required. Surgery is needed as a last resort, okay, to cut off each of this outpouching and to tie it off. Okay. So this is diverticular disease. Then colon polyps and cancer. So polyps, as I mentioned, it's a tumor kind of a situation. Okay, this is stage 0, which means this is a polyps. Okay, a tumor-like situation that grows inside the intestine, in the internal layer of the intestine. Okay, and with early detection, when you detect it early, as soon as possible, you can surgically remove these polyps so that it will not form into a cancer later on. But and a lot of screening tests are also possible to understand that you have polyps or has it become cancerous. And almost all colon cancers or colorectal cancers, they begin as polyps in stage 0. They are benign, non-cancerous. Okay, they don't spread, but in stage 1 onwards, slowly they start spreading. Okay, they start spreading into the muscular surface. It will the cancerous cell will form into polyps, and from the polyps it will start spreading into the intestinal surfaces. Okay, so cancer develops in this when these polyps grow and abnormal cells develop and start to invade and spread in the surrounding tissues. And once this cancerous cells reaches your blood circulation or lymphatic circulation, it can spread to other parts of your body as well. Symptoms, usually you will have difficulty in passing stool, pain, blood in the stool. Okay, sometimes it may, when the feces is passing through it, it can cause bruising to the polyps and bleeding may happen. Okay. Indigestion, diarrhea or constipation, both can happen. So treatment is cancer treatment. Whatever the oncologist will prescribe should be followed. Colitis, inflammation of the intestine is what we call as colitis. Several types of colitis is present. Infectious colitis, if there is an infection, that infection led to inflammation. Okay. Diet is also prescribed by the oncologist. Okay, because if they are undergoing cancer treatment, chemotherapy treatment, a lot of restrictions will be there. They will lose their appetite as well. Okay, so diet is prescribed by the oncologist. Ulcerative colitis, ulcer will be formed. Ulcer means it's an internal wound. Okay, a hollow wound will be formed in the layers of the intestine, and that could cause inflammation. Okay, then Crohn's disease, Crohn's disease, inflammation can take place throughout the intestine or here and there. Patches of inflammation can also happen in Crohn's disease. Okay. Ischemic colitis, when there is any obstacle or blockage in the blood flow to the intestine, enough blood is not reaching to the parts of intestine, that could lead to inflammation. Okay, that is ischemic colitis. Then radiation colitis after undergoing radiotherapy. If it is a cancer patient, colon cancer patient, okay, after undergoing radiotherapy, they may suffer from radiation colitis. Okay, because in radiotherapy, you're targeting specific tissues and cells in the colon, but destroying it. Okay, you're causing destruction of cells and tissues. Sometimes normal tissues and cells will also get destroyed. Okay, so that could lead to inflammation. So symptoms of colitis, diarrhea, rectal bleeding, abdominal pains, okay, urgency in passing or immediate need to pass or empty the bowels. And treatment depends on diagnosis, identifying what kind of colitis it is. If it is infectious colitis, what kind of infection? Is it bacterial, viral? Okay, based on that, medication will be given. If it is ulcerative colitis, anti-inflammatory drugs will be given. Crohn's disease, again, anti-inflammatory drugs, pain management. Ischemic colitis, you have to remove the blockage from the blood vessels, establish a good blood flow. Okay. Radiation colitis, you have to wait it out. Inflammation, anti-inflammatory medication will be given, but still you have to wait it out for the symptoms to subside. Okay. Next, Crohn's disease. As I mentioned earlier, Crohn's disease, inflammation is happening in the intestine, small intestine as well as large intestine, both intestines, okay? And it is chronic and long lasting, okay? A disease that causes inflammation and irritation to your digestive tract. You can see here how a normal intestine looks like and how an inflamed intestine looks like. Patches of inflammation, redness here and there, okay? So diarrhea, abdominal pain, weight loss, because when you have pain in the stomach, you will not be eating properly. So that leads to weight loss. Then doctors treat Crohn's disease with medication, bowel rest. That means you will not be given some solid food for a certain period of time. Okay, you will be on liquid diet or semi-solid diet. Surgery. Okay, if the inflammation is spreading, surgery. Goal of the treatment is to reduce the inflammation of your intestine as much as possible. Prevent flare-ups of the of your system as well. Okay. Sometimes flare-ups will happen. You have contained the inflammation for the time being, but after a few weeks, again the inflammation restarted. That is flare-up. Okay. Diet that is high calorie, lactose free, and low fat. So high carbohydrate, high protein diet is given. So that's about Crohn's disease. Celiac disease, it's a chronic digestive immune disorder that damages the small intestine. So you can see here in celiac disease, this is the intestinal villi. Intestinal villi is responsible for absorbing nutrients. They are long structures, elongated structures. Okay, they are long, elongated finger-like projections. Okay, it's normal. When it is celiac disease, the villi will undergo atrophy, which means it will become reduced in its size. It is no longer elongated. Okay, the length is gone. It's short. Okay, this is celiac disease. So it's kind of an autoimmune disorder as well that damages the small intestine. And it is triggered by eating food that has gluten. Gluten is a protein present in specific cereals and pulses like wheat, rye, barley, they all have gluten. So people who have celiac disease, they have to avoid eating gluten-based diet, okay? And this disease can cause long-lasting digestive problems. It can keep your body from getting all the nutrients that your body requires, because only when the normal villi is of this structure, long finger-like structure, only then they can absorb nutrients to its best. Okay. But when it is short in structure, it can't do that function properly. You will have to follow a low gluten-free diet when you are suffering from celiac disease. Okay. Then you have lactose intolerance, very common. Okay. Half of the population in India is lactose intolerant, but they are not aware of it. Okay. So whenever you have something that has lactose in it, like milk, cheese, okay, but not curd or yogurt. In curd or yogurt, lactose have been converted into lactic acid. Okay. So that does not have much lactose to cause an intolerance. So milk products, okay, they are the main sources of lactose intolerance. So whenever you have milk or milk-based products or cheese, okay, you feel bloating in your stomach, excessive gas, you feel full. Even with having a little bit of food, you feel full, bloated. There is abdominal pain. Some of you may suffer from diarrhea after having some milk or cheese. Immediately your stomach will get upset. You will suffer from diarrhea. You will feel like nausea and vomiting, constipation in some cases, and flatulence. Okay, farting a lot after having some milk-based products. Okay, these are the signs and symptoms of lactose intolerance. So if you have lactose intolerance, or if you have digestive system, symptoms like bloating, diarrhea, and gas, soon after you consume lactose, okay, it means you are lactose intolerant, and it can affect your health. It will keep you away from getting enough nutrients like calcium and vitamin D. Okay, even though calcium and vitamin D is rich in milk-based products, but whenever you have milk, and this is how your system is reacting, it means it is not doing a good absorption. Okay. Bloating, gas, diarrhea, nausea, pain in the abdomen, these are the symptoms. By changing your diet or limit the food that contains lactose, you can manage it. And using lactase-based products, okay, some products come with lactase. Lactase is an enzyme that can break down lactose. Okay, some people, even after childhood, okay, soon after childhood, most of the children in the teenage or in their adolescence or in their early adulthood, their body stops making lactase enzyme. Okay. Lactase enzyme is mostly made in the infant's body, newborn's body, infant's body, and in the toddler phase of your life. That's when majority of the lactase is made, when you are being breastfed. After that, slowly the production of lactase in your body goes down. Okay. So teenagers who suffer from a lot of acne, okay, if they stop having milk-based products, okay, there is they see a change in their skin, it clears up. Okay. It means the teenager was lactose intolerant. So you can replace the milk products with its substitutes. So that's about GI diseases. If you have any queries, you can mention in the chat box.